Antioxidants in male infertility. Now this topic looks very dry because most of us as an infertility specialist, we always, focus ourselves on the female partner. And because that looks very lucrative, the patient, normally it's a woman who comes to the ART center. Husband may or may not accompany her, she may just bring the reports. With the result, our focus always gets shifted from, both the partners to only the female. Now, I will give you the carry-home message in the beginning only, so that, even if you leave the hall early because of the boredom, so always, even if the husband reports are looking normal, even if he is perfectly normal, never tell that your husband is all right, the problem is with you. Because we have to be a little feminist, otherwise the whole burden of infertility goes on women and this poor lady suffers always. So even if you don't find anything wrong in the male, which normally is not there, at least give him something so that he is also involved in the management of infertility. That is my carry-home message. You all know that, the infertility in the males in the various regions is different. Maximum in the Middle East, 60 to 70%. And then in India, also, almost 50% is the cause of male infertility. It can be due to lifestyle, due to genetic reasons, hormonal factors, the varicocele, the systemic disease. And after having excluded everything, you still find that the 50%, in the cases we do not know what is the cause of the male infertility, and that is, put into a idiopathic male infertility. Now, Agarwal et al., they brought a very new term which I wanted to share with you. That is the male oxidative stress infertility. So, if you see the factor that 50% is due to the male, so out of all the infertile couples, 93 million is the number of male factor infertility, and out of that 50% is with a known or unexplained infertility, and in that patient group also you find about 28 to 30 to 40% will be because of the oxidative stress. And idiopathic infertility, which also is 50%, you find that you don't find any abnormality in the woman, you do not find any abnormality in the male, and still there is a factor which is causing the male infertility, and that is the oxidative stress. And this group of patients, which is now called MOSI or male oxidative stress infertility, they contribute to have a 80% of oxidative stress in the semen sample. So that's a very huge number. So why, so far, we were not able to say, okay, we are giving antioxidants, maybe it is just a placebo effect, or maybe, we are just giving hocus pocus and nothing comes out of it. Because we were not dealing with the group which required the treatment. And moreover, because to carry on any research, it has to be randomized controlled studies. So there are not very many randomized controlled studies because of obvious reasons. The male do not participate in these studies, and many of them they drop out. So with the result, in literature, you will find that there are various reports about the usage of antioxidants. Now I understand that many of you may not be infertility specialists, and there are about 10 frequently asked questions, which will be there in your mind. I'll try to, explain one by one to make it a little more interesting and more understandable. First is, what are the reactive oxygen species? Are they really always harmful? What is the effect of excessive reactive oxygen species on semenology? What are the causes of reactive oxygen species? What are the antioxidants? Do they help in improving the semen reports or the pregnancy rate? And how long we should be giving these antioxidants? And There are many antioxidants available. You find that many companies are coming to you and they say, okay, my product is better, my product is better. Can we suggest best 3 antioxidants which are having a, evidence A, B, or can we do anything other than the medications? Because, ours is a poor country. Many males cannot afford antioxidants which are costly. So can we suggest something else to them? Then can we do anything in the laboratory to prevent the deleterious effect of reactive oxygen species? And then the carry home message. So what are the reactive oxygen species? Now we all know that oxygen is very important for our existence of each cell of our body. And when the oxygen is working in various metabolic processes, it loses 1 electron and it produces the reactive oxygen species. These are very, very unstable. They have a half-life of milliseconds. So with the result, any research which we want to do it becomes very difficult. Because half-life of these and the reactive oxygen species is very less. They include hydroxyl anions, hydrogen peroxide and superoxide, and they want an electron immediately. And if the electron is not available, they would remove from the nearby cell and their components. They would do the peroxidation of the cell wall. They would call the DNA damage of the cell, and they will also affect the mitochondria of all the cells. That is why reactive oxygen species is not only important in the male factor, it is also known to cause diabetes, hypertension, malignancies, and so many other lifestyle issues, and also involved in the obesity. Now, antioxidants are available naturally also in the cells, and they donate the electron so that they do not destroy the nearby cells. But what happens if these reactive oxygen species are not quenched by the antioxidants which are normally present? So basically these reactive oxygen species have been divided into various categories. I will not go into that. There is oxygen as well as the nitrogen species, both act as a reactive oxygen species. So all these reactive oxygen species, are they harmful? Well, there is the ROS paradox. Reactive oxygen species are harmful, but yet to small extent they are required for the normal functions of the cells. So that means you can't, overload a patient with the antioxidants. So that will also be a harmful effect. Now in the cells, it is important to have some amount of reactive oxygen species to cause sperm capacitation, which helps the sperm to travel from the vagina to the uterus and to the tube to the site of fertilization, and to cause an acrosomal reaction so that it can enter into the zona pellucida and then cause membrane fusion so that the chromosomal material in the head can be transmitted for the further multiplication of the cell. Now, if there is an excessive reactive oxygen species, what happens to the semenology? Now, this reactive oxygen species can be because they are more being produced because of lifestyle and other things which I will be coming to you, or the antioxidants which are normally present in the cells are less in number. And this oxidative stress plays a vital role in pathophysiology of infertility and assisted reproductive techniques. Now, out of all the factors which cause increased oxidative stress, the two most important ones are the MAGI, that is the male accessory gland infections. So we see the semen reports and we find a lot of pus cells over there, and we have excluded them clinically or by the testing that these are not the premature sperm cells and these are actually pus cells. They are one of the commonest cause of reactive oxygen species. So if you see a semen report with this, and you must send it for culture and treat it. And the second is the abnormal shaped sperms, especially the, the early stages sperms, which have they have not released the complete cytoplasm. They are the one which will produce naturally the reactive oxygen species over there. Otherwise, varicocele, smoking, pollution, and drugs are the other sources of reactive oxygen species. Another very, very important cause of reactive oxygen species is long abstinence. Normally what happens, our patients feel, oh, my doctor is going to treat me, why should I waste my time with the wife now? And they have months of abstinence. And when you do the pickup, and he gives a semen sample of 15 days, 20 days abstinence, and as such, because of the dead sperms, would contribute to the reactive oxygen species. So in this slide, I want you to remember that please exclude infection and please exclude long abstinence in these patients, and also see the slide if there are premature sperms over there. And all these factors, they increase the oxidative stress, which affects the protein damage, the lipid peroxidation of the cell wall, they affect the fluidity of the membrane, and also the DNA damage, which we are talking today, that it should become a routine part of our semen examination, even if the semen count is normal in cases of unexplained infertility and other causes which I will be coming later on. And all this put together cause sperm damage and infertility. Why are sperms more susceptible to ROS? Each cell has got a cytoplasm, and that cytoplasm has got some natural antioxidants, while the sperm head is devoid of most of its cytoplasm. So that means the natural, the antioxidants which are supposed to be present, they are not present in the head of the sperm. And because second factor is that the wall of the sperm has got a high content of PUFA, the unsaturated fats, and these unsaturated fats, they get peroxidated faster by the reactive oxygen species. So out of all the cells in our body, the sperms are the most vulnerable cells to any increase in the reactive oxygen species. So it would affect the sperm functions, it will affect the integrity of the sperm DNA, and will also affect the count as well as the motility of the sperm. Now, is there any evidence? Yes, there are evidences to that effect, that in a non-selected group of infertile patients, that means we do not know it's a male or female or both factors are there, and even in that group, you find it may be 25 to 88% of these males may have an increased amount of reactive oxygen species. And patients who have an increased amount of reactive oxygen species, they are likely to have 7 times less chances of making the wife pregnant. So that is the importance. And in this slide, just look at the last line. Now in this study, what they did was, they compared the fertile donors and then the infertile patients with the normal sperm parameters and abnormal sperm parameters. And what they found was that the donors had a lesser amount of reactive oxygen species in comparison to the patients who had a normal semen parameters and infertile couple, and another group with all the abnormal sperm parameters were present. So that means the patients, even if has got a normal semen count, as per this paper, we must investigate for reactive oxygen species in cases of unexplained infertility. And there are some other papers also, I will not go into details. Now in this slide, what you see, they have measured the oxidative stress, and also they have seen if there is a antioxidant functions in that. There are various techniques of doing that, and what they found, that the patients of oligoastenospermia or astenospermia had a higher oxidative stress, and in the form of increased MDA and TNF alpha, and had a lower antioxidant natural activity in the form of the test done by SOD and GPX. I will not go into detail. So that means they have a higher reactive oxygen species and less antioxidant activity. The next question may be in your mind, how do we measure the reactive oxygen species? The most commonest is the chemiluminescence assay, and still it is not standardized yet, so we cannot really depend upon this. So new machine is going to come, which is already available in the foreign countries. It will come to India also. This is called a Antioxidant system. In this, there is a small chip. You just put a native semen sample and put it into the machine, and within 2 minutes, it would give you the redox potential. That means balance of oxidative stress and antioxidative properties. It will give you the balance, and which will give you in a quantified manner that yes, this patient requires antioxidants. Now, if that is available, then more research will be possible, because this will give you a more objective way of doing the research in the male factor infertility as far as antioxidants are concerned. But to all of us who do not have these facilities, how do we know that this patient may be having a increased reactive oxygen species? This is a slide which I want you to see. The patients who are having poor sperm motility, the patients who have an abnormal shaped sperm, that is teratospermia, or those who have more leukocytes in the semen, or when the semen sample is highly viscous, or when the Horse test is done and it is improper, and if you find that there is a poor fertilization in the IVF, the patient has come to you, she went to some other center and you saw the record of that, out of 10 oocytes, only 2 had fertilized. So before you start the stimulation, please exclude the high amount of reactive oxygen species in this group of patients. And then there is a sperm survival test. Now this should also become a part of our normal, because this is very simple. You just prepare the semen sample and dilute it to 6 million per ml, keep it in the incubator overnight and see how much is the survival next day. If you find the sperm survival is poor, then you do the testing further, or you can start the treatment with antioxidants. Or when there is a decreased blastulation rate in your laboratory, then this could be one of the reasons. So you must investigate. So even if you do not have facilities for testing the reactive oxygen species in the patients. Now, how to counteract and what are these antioxidants which can quench the thirst of electron of the reactive oxygen species? Now there are some which are naturally present, I told you, in the cytoplasm, and then there are some which are given by the diet, like vitamin C, E, beta carotenes and carotenoids and flavonoids, and then some metal binding proteins. I will not go into details, but various combinations are available in the market where some nutritional factors and free radical scavengers, they have been put together. Now, what is the evidence of these? Now, evidence A means, that means we know that they work, we know how they work, and they have been found reproducible by various studies. So out of all the antioxidants and micronutrients which you see in this list, only the coenzyme Q10 has got a level A evidence. So that means that you can give to all the patients with confidence. So the B is that where they are, we know that they are working all right, but then in some laboratories it's giving result, in some laboratories not giving. So they are like vitamin E, the L-carnitine and acetylcysteine, and then the last one is, we know that they work and it is reproducible also, but we do not know how do they work. It's not very clear as yet. So that includes glutathione, vitamin C, the selenium, zinc, folic acid and lycopene. So you have to make your own choice whether you want to give just CoQ or you want to add other things or not. So various commercial preparations are available. Now the problem is the constituents in that may be in a homeopathic dosage, which may not be sufficient for the patient. So it is a good combination, but the dosage is not proper. So you must see what is the required dosage and whether that combination has got it or not, and then only decide. Do they help, these antioxidants, in improving the semenology? Yes, it does improve it. I will not go into various papers, but this paper, if you see, Ross et al., what they did was, they studied various papers, and what they found was that 14 authors said that yes, it improves the sperm quality and pregnancy rate, and 3 said there is no improvement. Similarly, the motility, 10 authors said it improved, 6 said it did not improve. And concentration did not improve by say 10 authors, while it improved by 5 authors. And why there is such a disparity? I'll come to that. And morphology is the only one thing which does not improve much by giving the antioxidants, because supporting documents are less. But what is seen is that oxidative stress before and after the antioxidant, it does improve 100%. So there are various, these molecules which are being used, and they have been proved to improve the live birth rate and also the pregnancy rate in these patients. But what does the Cochrane say? At various stages, the Cochrane has been reviewing its own reports. The first one is the Chauvel et al. They mentioned that it improves the live birth rate and the clinical pregnancy rate, and also the Ross et al. They also mentioned that it improved significantly the semen parameters, and also antioxidants given to the infertile men have a beneficial effect on the sperm quality as well as the pregnancy rate. And again, these papers came that yes, there is an improvement in the sperm motility, particularly the patients who have a decreased sperm motility. And again, various papers are coming. I will not go. The Cochrane review again was done, and it did mention, but the last line is the most important line, that further investigation, every Cochrane review says further randomized control studies are required. So that is the thing, and this May again, this Cochrane review came by Lignet et al., and they again said further large well-designed randomized placebo-controlled studies are required. Unfortunately, because of ethical reasons and also difficulty to do research in this area, we are not able to get the randomized controlled placebo-controlled trials. Now, how long you should keep the antioxidant? That is the question which most of us, otherwise the patient is taking for months together, or we are given it to a very short duration which is of no use. So what does the literature says that minimum of 3 months should be given, because the spermatogenesis takes about 70 days. So you have to give anything more than 70 days. Whatever I give today, the effect will be seen after 70 days. And maximum you can give it is up to the 6 months. And if after 6 months also there is no change in the semenology, then please stop the antioxidant. Then don't keep on giving the antioxidants. Now, again, many antioxidants combinations are available. If somebody asks me which, any 1 or 2 or 3 you can give maximum, which you feel. To me, I think vitamin E, C and coenzyme Q10 are the one, and these are the one which have known to have a good effect, and they, in most of the studies it has been reproducible also. So can we do anything other than medications? Because many times, the males don't take medications, because they are working, going in the morning, or maybe having night duties and all, they forget to take the medicines. So can we suggest anything other than the medication to these patients who are known to have a, increase the ROS activity? First is lifestyle changes, the stress-free lifestyle, regular exercise, avoid tobacco, and they should not be taking drugs, alcohol, and healthy diet with vitamins, supplements if possible. And one most important thing today is the mobile and the laptop usage, because of the electromagnetic waves which are creating, that is further creating the havocs. And these are the 7 most important which any Indian can afford to take it. Out of that, at least 4, like Rajma, we all take it. Even the poorest of poor family take Rajma. So they should be advised to introduce Rajma in their diet, and they can take tomatoes. It's not difficult to take it. Spinach is not very difficult to take. So this, even a poor person can take it. While the dark chocolate is for us, and barley and broccoli and berries, they should be added into the diet. So we must educate them about the diet also, which is possible even for a poor couple as well. So anything in the laboratory which we can do to circumvent the bad effect of reactive oxygen species? Yes, avoid any technique which uses repeated centrifugation of the semen sample, because repeated centrifugation causes more ROS activity. And secondly, there are some papers where they are adding vitamin C, vitamin E, cysteine, taurine and hypertaurine to the culture media, And in times to come, we will get this type of cultural medias so that we can give better pregnancy rate. And if the semen count is okay, and if there are not many pulses, and the motility is good, so better use the simpler techniques, that is a direct swim-up technique, where you don't do any centrifugation, or microfluidics if it is possible. And if it is possible, avoid using the frozen semen sample. If he gives a fresh sample, like you have frozen for whatever reason that he has got a situation and ejaculation, so you have frozen for that case. But on the day of IUI or IVF, ask him to give the fresh sample. If he gives a fresh sample, preferably use a fresh sample because that will have a lesser ROS activity. And finally, the carry home message. Again, there has to be a balance because the reactive oxygen species can come from outside or because of infection, we must treat it, and lifestyle modifications, vitamin supplements, and vasectomy if it is present, should varicocele is present, the vasectomy should be done so that that will increase their antioxidant activity, and if you balance it, we can get a better result. And finally, how to manage a male infertility, just a fast one. Now we do the basic semen analysis. We find that it is normal, or we are suspecting the patient to have a reactive oxygen species higher. So we find that it is high, oxidative stress is more. You see, if there is evidence of inflammation or pus cells are there, give antioxidants, antibiotics, anti-inflammatory, and again test for the reactive oxygen species. If it is corrected, then you take the patient for treatment. The second one is a lifestyle and obesity change treatment, and again you check for the reactive oxygen species, and if you find it is all right, and then you take the patient for ART. And if varicocele is there before surgery and after surgery, after at least 3 months of surgery, you do the reactive oxygen species test again. And if the patient has got no other factors, only the oxidative stress is increased, give them antioxidants for 3 months and test for the antioxidant activity and the reactive oxygen species by this technique. And if it is corrected, then only take the patient for ART. And always involve, finally again I said in the beginning, involve the male in the management of infertility. Even if he has got a normal count, even if he is having a normal sexual function, still he may be the cause of infertility as well as subsequent abortions, unless proved otherwise. So it is always better to treat male, even if you are giving as a placebo, it will help at least to make the family, because we as an infertility specialist are making families, we are not breaking families. Thank you very much.